Well, vertigo can be a debilitating symptom that can be suffered at any age. Joining us now to look at the causes and treatments is our resident Dr Frances Pitsilis. Good morning to you, Frances.
Morning, Mel.
This is an interesting subject. I mean, I've always wondered about dizziness and vertigo because I do suffer from a lot of dizziness. What is the actual difference between those?
I think the dizziness is where you feel unsteady, lightheaded, floating, swaying, those sorts of descriptions, whereas I call it vertigo.
That's probably the right
Some
one.
people call it vertigo. It doesn't matter. Whereas vertigo, you actually feel that you're spinning. The world around you appears to be spinning because something's not working properly inside.
Right, so you're standing still, but the world is spinning around you. What's the cause of them?
Well, there are generally, this is a huge topic, and for me to try and simplify it, I think it's easy to say brain causes, which generally cause the sense of dizziness, and usually related to problems with the centres of the brain that help you with balance and coordination that might be affected by stroke and those sorts of things. And then you've got the ear-related ones that definitely give you that definite vertigo, that spinning sensation. And when it's the ear, it can affect the balance mechanisms that are due to those three-dimensional semicircular canals, or it can affect the nerve of balance that comes and touches those semicircular canals.
Right. So what are the most common causes of acute vertigo?
So the commonest causes are vestibular neuronitis, which is really just the name for you got a virus and now you've got vertigo.
Right.
Or you may not have even known that you had a virus or a chest infection, and you get this acute vertigo and you have to have pills to stop the nausea, and then it passes over a few days. And then this other main condition called benign positional vertigo, quite common really, where people sort of turn their head or for no reason, or they've had a knock on the head and they start getting this vertigo. And what happens at the doctors is the doctor suspects it, they do a manoeuvre that's both therapeutic and diagnostic.
Is that the one where they throw you back on the bed?
Yeah.
Oh yeah, I know the one. I know it well.
The Dix-Hallpike manoeuvre, and there are all these other manoeuvres, right? But what's really important about this benign positional vertigo is that you don't want to miss that your blood pressure's not under control, that you've got diabetes, that you've got low B12, and this condition's associated with migraine, estrogen deficiency and chronic head and neck pain. So you don't want to just keep treating your patient with the manoeuvre. You want to find out what else is going on underneath.
Well, that's the thing, isn't it? There can be so many causes and things that could be of concern. So what do doctors not want to miss?
Well, what's important is you don't want to miss simple things and really nasty things. The simple things are wax in the ear, check the ears, it could just be wax, or someone's actually hyperventilating, anxious and stressed, and really they need help with that, and not to go to the hospital and have all sorts of testing done. But the nasty things not to miss are brain tumours in general, but also an acoustic neuroma, which is quite a rare benign growth of the nerve of balance. And it's not cancerous in the sense that it will kill you, but it causes pressure on other structures. And of course, migraine, transient ischemic attack, which is like a temporary stroke, a stroke, multiple sclerosis and similar conditions. So you really need to be careful about all of this and see your doctor.
That's a lot to think about. So how do you actually treat vertigo?
Well, you need to know what the cause of it is, and so you can support that cause. When it comes to specific treatment, well, you can give people anti-nausea medicine if they're very vertiginous. Not for the dizziness. For Meniere's disease, which is an acute vertigo, it's not common, and there's specific medicines for that, and for the autoimmune diseases. And ultimately, with many of these conditions, if you're not getting anywhere, you can have something called vestibular rehabilitation.
And that's the thing, these conditions can drag on with no real outcome. So what is this vestibular rehabilitation?
Well, this is where a specialised physiotherapist will give you special exercises to help your whole system cope, your balance, your brain, your gait, the whole thing helps you cope, and then you don't feel as distressed.
So what do they actually
What do they do?
Yeah.
Well, what the physiotherapist does to start with is that they assess your balance, your gait, how you walk, how your body is when you walk, your visual stability, your mobility, your neck stability, and then they give you exercises and they train you in posture, strengthening, stretching, balance, walking exercises, neck mobility, and general fitness. So it's quite a big, like a comprehensive program to help you cope with all of this.
And these things can all help.
Yes.
Is it any physio that's trained in these, or do they have to be specially trained?
I think that they specialise in it, so you really need to Google vestibular rehabilitation.
Because it can be very debilitating if you've got ongoing dizziness.
I agree with you.
So any final words, Dr Frances?
I think it's most important to check in with your doctor, especially if it's new or one-sided.
Okay, so check in with your doctor. Is there any length of time that you should consider that you'll have these symptoms, or just go straight to the doctor?
I think you should go to the doctor. I don't think you should accept dizziness or vertigo that's happened to you for the first time and just say, oh, well, I'll wait it out. You really need to know what's behind it.
Okay, so go, and then, because it's all to do with this and this.
It's important to check it out.
Go and get it checked out, and hopefully it'll be absolutely nothing. Well, thank you so much, Dr Frances. It's an interesting subject, actually. And if you are concerned about anything that we have discussed, please contact your own healthcare professional.